Well, thanks for sticking with us for Live Impact News on this Wednesday morning. I'm Marta Berglund, and as I mentioned before the break, we are going to be joined now by an entomologist, Dr. Jim Fredericks, to give us the latest update on West Nile virus, which we're seeing an increase of across the country in the last few years. So he's going to tell us a little bit about what we need to be aware of, if this is a concerning trend, etc. Dr. Fredericks, thank you so much for joining us.
Well, thank you for having me, Marta. This is really something that folks, need to take seriously because so often we think of mosquitoes and other pests as simply a nuisance. But as is the case with mosquitoes and some other pests as well, they can be a real threat to people's health and the health of their families. So this is the time of year when West Nile virus cases tend to ramp up, but CDC is now saying that this is they're the most cases and the earliest cases that they've seen in almost 20 years. And so it's especially important right now to be vigilant to protect your families from mosquitoes.
Mm. Can you talk to us first about, as an entomologist with the National Pest Management Association, what your role is, what you do, and what you're looking for when it comes to pests like mosquitoes?
Sure. So the National Pest Management Association works with pest control companies to make sure that we're able to educate consumers about the importance of pest control. And that's pest control, including mosquitoes and ticks, but also cockroaches and rodents and many of these other pests that can cause impacts to public health, food, and property. So this time of year, we're thinking about mosquitoes and in particular, protecting people from mosquitoes. And so if there were three things that I would tell people, three things that people can do to protect themselves from mosquitoes right now, it would be to make sure that when you're outside in areas where you know there's going to be mosquitoes, make sure to be wearing an EPA registered insect repellent. Around your home, do a check to make sure there is no standing water. If there is standing water or containers that could collect rainwater, to remove that. And then also it's a good idea to work with your pest control professional to develop a management plan to control the mosquitoes and reduce the populations of biting mosquitoes around your home.
Mm. And I'm a person who the mosquitoes love. For some reason, it feels like some people they get attracted to them more than others. Can you talk a little bit about what people should know when it comes to West Nile virus? Is this something they'll know if they have, or should they just assume, the mosquitoes are bad, we should keep them away?
Well, I think yes. Assume mosquitoes are bad. These are flying insects that want to drink your blood, after all. But it's interesting with West Nile virus. Only about 1 in 5 people actually develop symptoms, any symptoms at all. And so you could have West Nile virus and be a carrier. And if mosquitoes would bite you and then transmit it to someone else, that is often how this can be transmitted without folks even knowing that they have it. So about 1 in 5 people develop symptoms. About 1 in every 150 people develop severe symptoms. And so what does that mean? What are the symptoms here? So we're talking about things like fever, headache, body aches, even vomiting. In severe cases, that can be a very high fever that could result in confusion or even body tremors or seizures. A stiff neck is often associated with some of these severe cases, and in these cases, in all of these cases, it's important to make sure that you seek help from your physician. So seek medical help if you develop any of these symptoms. So fever, headache, fatigue, body aches. Go to a physician and get checked out, and let them know if you do know that you've been bitten by mosquitoes, so they can adjust any of their testing appropriately.
And we know here in Hampton Roads, we have had some mosquitoes detected with West Nile virus in a few of our cities. Can you talk a little bit about, is there a reason that we're seeing an increase in these cases? Is it environmental? How does that work?
Yeah, so it's hard to say exactly. There's probably lots of factors that go into why These This year in particular, we're seeing a kind of an earlier onset. The peak is usually August, September, but CDC is reporting that these cases are showing up earlier and in greater numbers. But whenever we have hot, humid, wet weather, that's the perfect environment for mosquitoes to breed. A lot of people don't realize this, but mosquitoes, we think of mosquitoes as flying insects, but most of their life is spent in the water. So standing water, eggs are laid in the water. The larva and the pupa of mosquitoes develop in water, and then they emerge as these flying, biting mosquitoes that we all love to hate. So it's important to remove those water sources. So, around your home, standing water like flower pots or children's toys or neglected pools around the house. These are all places that could collect water. But things that people sometimes don't think about are maybe gutters around the roof line. Make sure that your gutters are free flowing. If they're clogged, that's a place where mosquitoes could be breeding on your property. So hot, humid weather is mosquito season, but even when it's not raining, when there's drought, what happens is that mosquitoes will tend to be more populous closer to where people live, because that's where folks are watering their lawns. They have pools and bird baths, and so mosquitoes will tend to concentrate their populations near where people are, which leads to this sort of an outbreak.
Mm-hmm. Aside from the symptoms of West Nile virus, are there any other things people should be looking out for that if they are bitten by mosquitoes, they should say, okay, this isn't a regular symptom, or this is something where I should go see my doctor, aside from the nuisance itching?
Yeah, so naturally, we're all familiar with the itchy welts that mosquitoes leave behind, and that's due to an allergic reaction that your body has to mosquito saliva. In fact, but whenever you have, I encourage folks to if you have any of these symptoms. So if you develop a fever, it's a good idea to see your physician. If you know you've been bitten by mosquitoes or lots of mosquitoes, it's a good idea to mention that. Is it going to be West Nile virus? It's hard to say, but it's important for your physician to have that information so that they can kind of hone in on the likely or potential reasons for this illness.
Can I also ask you, as the National Pest Management Association, what kind of research are you all doing in relation to West Nile virus this time of year? Are you surveying mosquito populations? Are you studying their populations and the disease levels? What all steps are you taking?
Yeah, so we are not doing that research. We rely on local researchers, local entomologists that are focused on public health pests like mosquitoes in counties and at the state level, as well as the CDC, to do this monitoring. So they're doing monitoring of both the mosquitoes and the disease cases, which need to be reported back to CDC through the state departments of health. And so our role in this is to simply get the word out so that people are aware of the potential threat of mosquitoes and then take the steps that they can to protect their families. One of the things that's interesting is we often think about mosquito bites happening in the evening, right? So after dark, perhaps. But there are mosquitoes that will bite, aggressively during the day, and one in particular is the Asian tiger mosquito, which is an aggressive daytime biter that people will very often encounter around their property, around their homes.
All good reminders. And thank you for clarifying your all's role and how you kind of work with local health departments. I'm going to go a little bit away from mosquitoes because you mentioned monitoring other pets. We're located in Southern Virginia, so we have, the cockroaches, the rodents, all of that good stuff. Are there any other pests during these summer months that you guys are extra concerned about or that people should be extra aware about?
Yeah, and this is yes. In fact, and this is another pest that is that's often thought of as part of summertime outdoor life, and that's stinging insects. And I mention this because stinging insects send 500,000 people to the hospital every single year. There are people. Some people have a severe allergic reaction to stinging pests, and in large numbers, these stings, which are venomous, can be life-threatening. And so I'm talking about things like wasps, hornets, but also red imported fire ants in the Tidewater area of Virginia. Red imported fire ants have been found, and all of these produce stings. And our best advice is when you encounter these types of pests in your yard, perhaps you find a nest around the backyard, to call a pro. This is not a do-it-yourself project. Pros are outfitted with special safety equipment, suits that will protect them from stings, and equipment that they use to reduce the likelihood of these dangerous stings from stinging insects.
All right. Well, thank you so much. We really appreciate all the information, both on mosquitoes and all those other pests that we need to worry about this time of year. Dr. Fredericks, thank you so much for joining us.
Well, it's been a pleasure. Thank you.